The Marburg virus is a highly infectious virus that causes severe hemorrhagic fever in humans and non-human primates, similar to the Ebola virus. Here are 10 scary but interesting facts about the Marburg virus. Number 10. The Marburg virus is named after the city of Marburg, Germany, where the virus was first identified in 1967, after an outbreak among laboratory workers handling infected monkeys. It was at the Behringwerke pharmaceutical factory, now known as CSL Behring, in Marburg, Germany, where lab workers were handling African green monkeys that had been imported from Uganda for research purposes. The workers became infected with the virus, developed symptoms of severe hemorrhagic fever, and several of them tragically died from the disease. The outbreak resulted in the identification of the Marburg virus as a new and highly infectious virus. Number 9. The Marburg virus is believed to have originated from fruit bats, which are considered natural hosts for the virus. The exact mechanisms of how the Marburg virus is transmitted from bats to humans is not fully understood, but it is believed that bats may be natural reservoir hosts for the virus. Bats are believed to carry the virus without getting sick and can shed the virus in their urine, feces, saliva, and other bodily fluids. People can become infected with the Marburg virus if they come into contact with these bodily fluids of infected bats, or if they come into contact with surfaces contaminated with the virus, such as fruit or other food items that have been contaminated by bat droppings or urine. In addition to direct contact with bats or bat secretion, many people can also become infected with the Marburg virus through contact with other animals that have become infected with the virus after coming into contact with infected bats, or through contact with other infected humans. The virus can be spread through close contact with infected individuals, such as through exposure to blood or other bodily fluids. Number 8. The Marburg virus is one of the most deadly viruses known to humans, with a CFR of up to 88%. Case fatality rate, or CFR, is a way to measure the severity of disease and is calculated by dividing the number of deaths from the disease by the total number of people diagnosed with the disease. The CFR for Marburg is up to 88%, depending on the strain, meaning up to 88 out of 100 of those who are infected could die. Number 7. The symptoms of Marburg virus infection include fever, headache, muscle aches, vomiting, diarrhea, and bleeding from the eyes, gums, and nose. The symptoms of Marburg virus infection typically develop suddenly and can at first seem similar to the symptoms of other viral infections, such as the flu. However, the disease can quickly progress to more severe symptoms, including severe diarrhea, vomiting, abdominal pain, and bleeding from the mouth, nose, and rectum. Number 6. There is no specific treatment or cure for Marburg virus infection, and the standard care is supportive therapy, which includes maintaining hydration and electrolyte balance, controlling fever, and treating any secondary infections. Number 5. The Marburg virus has caused multiple outbreaks worldwide. Although it is not as well known as the Ebola virus, it has caused several deadly outbreaks, primarily in Africa, including outbreaks in Angola in 2005, which saw over 200 cases of infection, with a staggering 90% fatality rate, and Uganda in 2012, where 15 of the 20 people infected with Marburg died. Number 4. The virus is transmitted through contact with bodily fluids of infected animals or humans, and can be also transmitted through contact with contaminated surfaces. Transmission of the virus can occur through broken skin or mucous membranes, such as the eyes, nose, or mouth, and also through contaminated surfaces, such as bedding, clothing, or medical equipment. Healthcare workers and other individuals who come in close contact with infected individuals are at high risk of infection, particularly if they are not wearing appropriate personal protective equipment, or PPE. Thankfully, however, individuals with the Marburg virus disease are only contagious when they are showing symptoms of the disease, such as fever, muscle aches, and vomiting. The virus is not transmitted through the air or through casual contact, such as shaking hands or hugging. Number 3. The incubation period for the Marburg virus is typically 5 to 10 days, but can range from 2 to 21 days. The incubation period is the time between the initial infection and the onset of symptoms, which can vary from 2 to 21 days, but the average incubation period is usually around 5 to 10 days. During the incubation period, The virus replicates and spreads within the body, but there are usually no symptoms of infection. Infected individuals can transmit the virus to others during the incubation period, which is a significant concern for public health officials. It is possible for some individuals to be infected with the virus, but not show symptoms or only have mild symptoms, while others may develop severe and life-threatening symptoms. Number 2. The World Health Organization, or WHO, considers the Marburg virus a potential bioterrorism agent, and there is concern that the virus could be used as a weapon of mass destruction. Political turmoil in many countries and heightened tensions between different nations can increase the risk of bad actors taking advantage of a volatile situation to inflict harm upon others. Number 1. Like all viruses, Marburg has the potential to mutate. A mutated Marburg virus could theoretically result in a more lethal or more transmissible form of the virus. However, there is no evidence that the virus has mutated in this way so far. Mutations can occur naturally, as the virus replicates itself, and can result in changes to the virus's genetic material, potentially altering its behavior or characteristics. Some mutations can make the virus more contagious or virulent, while others can make the virus less harmful. Overall, while the Marburg virus is a highly dangerous and deadly virus, it has several disadvantages that limit its outbreak potential. However, it is still important to remain vigilant and take appropriate measures to prevent the spread of the virus in the event of an outbreak.